Okay, it's noon by our clock, so we're going to go ahead and get kicked off here. Just before we get started, I want to do a little housekeeping. My name is Brooks Ballard. I'm with the Michael and Susan Dell Center for Healthy Living at the UT School of Public Health here at the Austin Regional Campus. And we're really excited to help host the webinar here today. Just to run through some of this technical stuff, first, I want to let everyone know that this webinar is being recorded. It will be archived, and it will be put up on the msdcenter.org website later this week. Second, we would love to have questions from you today. We encourage you actually to submit them through the questions box, which is in your control panel on your screen. And you can submit those at any point during the webinar today, but we are going to try to hold off on answering those until the Q&A portion at the end of the webinar. If there's any technical issues or anything, feel free to message any of the organizer on here, and we can try to troubleshoot anything with you. But with that, I'm going to go ahead and hand it over to Alma here, who is going to kick us off.
Great, thanks so much, Brooks. As he said, I'm Alma Carver, the Project Director for the Texas Mother-Friendly Worksite Technical Assistance and Support Program here at the Michael and Susan Dell Center for Healthy Living. And today we have our first of this series, the Outstanding Mother-Friendly Worksite Series, and today we'll be talking through the hospital perspective. Just to give you a brief sense of the agenda for today, we'll have a brief introduction of the Texas Mother-Friendly Worksite Program from Julie Stagg, the State Breastfeeding Coordinator out of the Department of State Health Services. Then we'll jump into the JPS, or the John Peter Smith Hospital Journey, with Pat Alridge and Susie Juliano. And then we'll follow that up with lessons and tips from the Lyndon B. Johnson Hospital in Houston with Maria D'Souza. And after that, we'll have the Q&A session. As Brooks mentioned, you all can ask your questions at any point throughout the call, and we will be noting those for that Q&A session, and then we'll take you through some next steps. So at this point, I'm going to hand you off to Julie Stagg, who will talk us through a brief introduction of the program.
Hello, everybody. Thank y'all for joining us today. I'm Julie Stagg. I'm the State Breastfeeding Coordinator at the Texas Department of State Health Services, and one of the programs that we administer as part of our comprehensive program of breastfeeding support is the Texas Mother-Friendly Worksite Program. This program was founded in 1995 and created to fulfill legislation to recognize employers that proactively support breastfeeding through a written and communicated breastfeeding support policy. At minimum, a mother-friendly worksite policy needs to address provision of a private non-bathroom space, flexible scheduling to allow time for breastfeeding breaks or lactation breaks during the workday, and access to hygienic water and storage alternatives. There are many more comprehensive things that can be included in a worksite lactation support program, and since the time this program was founded, there's been a lot of study at the national level that demonstrates a return on investment of $3 for every $1 invested by employer in worksite lactation support. The Mother-Friendly Worksite Program is open to any employer in the state of Texas to apply for and be recognized and use the designation in their outreach and recruitment for employees. We do also promote the program through our Texas 10-step program, and we consider it step 0 of the 10 steps before a facility can support their patients with breastfeeding. Starting at home with their employees is a great start to model breastfeeding support. And nationally, the American Hospital Association promotes initiatives such as these to all facilities, birthing facilities or not, to create a culture of wellness and become a model in your community for total wellness. So I'm happy to be here today, and we're happy to hear the stories that Pat and Maria will share with us, and Susie will share with us about how they've implemented these programs in their facilities. I'm going to turn it over to Pat now.
Okay. Thank you, Julie. As Julie has said, Pat Alridge, and I believe you're seeing that on the screen. I'm the Nursing Executive Director for JPS for Women and Children's Services, and I'm happy to be here this afternoon. So next slide, please.
And hello, my name is Susie Juliano. I'm the manager for our mom-baby unit here at JPS, as well as the inpatient and outpatient lactation services that we provide here for our patients.
Okay, next slide. Thank you. So our journey began with a grant in 2011 from DSHS that Julie was instrumental in making happen for us. We have promoted a dedication to supporting our team members who have chosen to provide breast milk for their infants, and we were able to make this happen through a lot of tough turns in the process, and you'll hear about some of that today. Prior to this grant, we actually had one patient room that we provided for our NICU moms to pump in, and we had one employee room within our women's services area that was primarily used by our staff. JPS has approximately 5,500 employees. When we applied for the grant, we had about 4,700, and 26% of those were between 20 and 34, and that number rose to 36% if you added the 35 to 39-year-olds. And employees basically had to pump wherever they could find a space, storage rooms, offices, unused patient areas. So it was a dark day. Next slide, please. So our implementation process basically mirrored the materials that we received from Julie. I had a huge binder with every kind of resource in it that I could possibly need. But we adopted the process that came with the kickoff materials and so we simultaneously identified spaces and learned how to try to maintain the occupancy of the existing employee room. About this time, the one room that we had that was being used by employees changed ownership. It was passed off to Physician Affairs, and so that was my first journey to try to persuade someone outside of my area why we needed the space to remain with women's services and for employee use. And as some of you may know, it's not always easy when there's physicians and their needs involved. There was also a push to revise the existing organizational policy in support of breastfeeding. We had a breastfeeding policy, but it did not include employees. We also had to create an educational program that was supported to support our employee education, and that department was responsible for distributing the education to our employees. One of the unpopular things we had to do through the implementation process was address the time factor for how long employees would go off to pump and how frequently they would have to do that. And so we had to make sure that that was addressed in the policy because that question came up a fair bit. And again, when we kicked this off, we obtained executive support. Our CEO supported us and signed the letter of commitment, as well as our VPs over the various divisions, human resources, compliance. They all basically supported us and attended a presentation by Julie Stagg that kicked it off as the official kickoff. Next slide, please. So you can see that we had a timeline for implementation that began back in April 7 of 11, and we're still working on this. So it's a long-term, very, very long-term plan. But we implemented a subcommittee of our breastfeeding task force called the Mother-Friendly Worksites subgroup. And that was the group that was charged with leading the push to actually get more space and to get these things approved that had to be approved in order to meet the criteria for the program. I found myself attending every executive forum with my spiel about how we needed to support our employees in this way. And I attended the CNO forums, the CEO leadership forums. We had network team leader meetings, and I felt it was really important that I actually got to speak to the supervisors of the floors, the nursing areas, directly, because those are the folks that are responsible for getting the employees covered or at least freed up so that they can go and pump when they need to. So it should not be just the manager who has the insight and the education. Okay, so next slide, please. So after we had identified some additional rooms that we needed to bring as part of the program, we identified 3 different spaces that would give us a total of 4 rooms for our employees to be able to pump in various locations. And so we had to come up with a budget that we submitted to DSHS for the cost of the implementation based on the equipment, the pumps, the comfortable chair, the light. We wanted a soft lighting. We wanted to create a warm, cozy space that someone would feel comfortable pumping and be able to let down successfully. So the approximate cost was about $2,600. Because we're a hospital, all the equipment and the furnishings that were purchased had to be hospital grade, and so that added to the cost. But it does not include the cost of renovation for the room, and if there was a sink that had to be installed, or cabinetry, etc. So this was just purely for the supplies in the room to make the mother as comfortable as possible. We purchased 3 hospital-grade pumps at the outset because we were really planning to add the 3 rooms. And we'll talk about that in lessons learned a little bit later on. It was such a hard struggle to try to get the 3 rooms that we got. We really didn't think big time enough. And so anyway, we'll share that with you in a few more slides down the road. Next slide, please. So some of the additional benefits that we were able to obtain from our vendor who supplied us with the pump was the pump attachment kit. So there was no cost to the employee for that, and also a cool and carry breast milk storage system, and also obviously free access to our lactation consultants. When we started this program, we had 4 lactation consultants, a working day shift. So how do we monitor our rooms? We assigned them to the lactation department to oversee and to make sure that they were being kept clean and also had all the supplies they needed. And we asked the team members who were using the rooms to sign in and out basically on the honor system. And we found that we had some challenges with that when we got a little busier, but we'll go through that. Next slide, please. So part of the adoption of this project by the organization, and not just a women's services project, was that our HR department decided that this was no longer a patient care policy. It was actually an employee benefit. And once that decision was made back in 2013, they decided that they would update and upgrade the education that we put out to all the staff, and they used avatars for that. And the leadership of HR decided that they wanted all employee education to basically be formatted the same. And so that caused a delay in the updates that we were able to put out. But I decided not to share with you my avatar that they put out for me. It's got way more curves than I do. So, so the policy was adopted by HR as a benefit, and also the issue with being linked to HR was that we now were facing with who would get educated on the program and how often. And these were things that I went back to Julie and clarified just to make sure that we were meeting the letter of the intent for the rollout and also for the ongoing education. Our human resources decided that it would not be a mandatory education. They stopped shy of making the word mandatory. Instead, they included it for all new hires at new hire orientation, and the CBL, which is the computer-based learning module, was assigned to every leader in the organization to push out to their staff for required education. And so, as I said, the benefit was that it was no longer a Pat Alridge women's project. It became a marketing tool for recruitment, for advertising, and listed among the employee benefits of working at JPS. This was quite the kickoff for us when this happened, because I started getting emails from employees everywhere with questions, or if they were having issues, or just really to clarify. And the most frequent question, as I've said, was how often can the employee go to pump and how long can they go for? So the policy that was adopted and approved addressed this, but left the verbiage non-specific, and I'm going to quote it from the policy. While at work, time will be given for staff to access a pumping area in an effort to provide adequate stimulation to maintain a milk supply and provide human milk for baby. Obviously, the organization did not want to paint themselves into a corner where they were prescriptive about how often someone could go and how long they could go for. And people were very surprised when they would ask me how long it takes to pump, and I would say, well, it can take, you know, anywhere from 20 minutes to 30 minutes, depending on how much milk and how comfortable they are and how soon they can let down. I think everybody thought that they would go off for 10 minutes and come back, and that would do the job. So that was quite eye-opening. But next slide, please. Next slide. Thank you. So part of our challenge with an organization the size that we have a campus, a hospital campus, plus we have office buildings. We have 19 outlying clinics, plus 19 school-based health centers. With how do we provide this benefit for every single person who might need it? And in order to do that, we worked, obviously Susie and I worked on this to come up with a process where we could provide the employees at outlying clinics the same quality of pump and the same accessibility to the equipment that they needed, even though the room may not be the same room. And in order to accomplish this, we actually instituted some mobile lactation stations. And I have a picture of those in a slide coming up. But this is the algorithm where they were checked out and how they were checked out. Again, it was very important to me that everyone had the ability to be able to do this and have the supplies they needed. So, and as I said, we'll show you a picture of those shortly. Next slide, please. So our pump room locations. We started off with the first one on the list here for 2 North on the mom-baby unit, and then we added the ones basically after that. Everything after that came following our implementation. 3 of these rooms, the one on the Pavilion, the Tower 3, and the Health Center for Women Maine, were the 3 that we implemented with the grant, and the rest have come up after. Basically just through sheer determination and also the need. On the coming soon, we have our emergency department, Pavilion 4, admission holding, and South Campus. And our CEO has regular employee forums where he asks for feedback of issues that people are having or concerns. And he is starting to get feedback about the fact that we don't have enough lactation rooms, which is a wonderful problem to have, but there's nothing like sharing something like that with the CEO for it to get onto the radar of the folks who can make this happen. And that's exactly what's happening, why we're able to add 4 rooms very soon. So next slide. So our program, as you can see, has grown from the 1 room to now we have actually 7 locations and 4 more to come. But with growth, we found that we had some specific challenges that we had not anticipated. It used to be that we would encourage the moms to actually and have their break and enjoy their break in the room when they pumped, and suddenly we found that the rooms needed to turn over, and so once they had actually pumped, we had to encourage them to actually move on so someone else could come into the room. So we developed a pump room agreement, Susie and her lactation folks, because again, when we started this off, it was very few staff that were using this, and as the time evolved, we really found that we had to meet the challenge of how do we keep the rooms turned, how do we keep them clean, how do we make sure that we have supplies in the room, the washing up items that are so necessary to being able to use the room and keep it clean and keep your equipment clean and washed. And so again, it's a great problem to have, but it did kind of take us by surprise. Next slide. This is the slide. This is the picture of the mobile lactation station carts. This was what I came up with in order to provide for the employees who are at remote sites. The utility carts were not expensive, and more importantly, they fitted very nicely the hospital-grade pump, the cool and carry kit, the bottle brush, also the attachment and the mesh bag that we use to put the tubing, etc., for sterilizing, and it all fits really nicely with the dish soap and everything else. So we found that this was a very popular alternative. Employees signed them out, as we showed you on the algorithm, and so they get to keep the cart and the contents throughout their whole time that they're trying to pump. And so it's convenient, and I think we had good results with that. Plus, remember, our employees also have access to an IBCLC. And as the program grew, so did our lactation consultants. So next slide. This cart doesn't look quite as comforting as the utility cart, but we found that for areas like the operating room and the PACU and our psychiatric hospital, we were able to put all the supplies into a cart that was movable, but it didn't need to be quite as mobile as the individual carts. And so the operating room would have areas that would rotate, that they would allow employees to use. PACU was the same, and our Trinity Springs was the same. So if there was not a fixed room that the employees could use, we needed something that was mobile, that would still house everything that needed to be housed. And we've had good success with maintaining these carts in those areas. Next slide. And so Susie and her lactation folks, this is the mobile tracking system that we started off with, that has had a few iterations since then. But again, the pump station etiquette, you wouldn't think you would need that for women who are really committed to pumping, but you do, because people would bring their food, as we encouraged them to do, but they would leave really, how can I say, food with not so friendly odors when they were leaving the room, the station checklist, and then the traveling tote checkout. So again, these all came about as part of the materials that we received, and we were able to develop them. Next slide. Next slide. Thank you. So tracking usage, our tracking forms were updated to add department. We found that the honor system did not work as well when the rooms got really busy. And the busier they got, in fact, the worse it got, because we found people were just actually handing off the keys to the next person instead of having them actually sign in and sign out. And so we found that the best tracked rooms were where the key was assigned and had to be signed in and out, usually by a unit secretary or someone in that type of designation who actually controlled it. And then they were able to maintain EVS access for housekeeping, and also make sure that the supplies and the paper towels, etc., was available, and that it was kept as it should be. And that really took some follow-up meetings that Susie had with our EVS folks to make sure that we had the commitment that they would do that. We added department to the form because what we found was that there were different disciplines coming from all over the hospital, and different sites to actually use different rooms. And we found we had the chaplains, we had RTs, we had pharmacy, different departments that would take advantage of the rooms. And so what we were able to do with that information was I would go then back to the leader of the department, usually my counterpart, and explain that we really needed to find additional space, and they had employees who were pumping, and this would be a great opportunity for them to actually donate some space or a room for them to be able to pump in.
Yeah, this is Susie. I just want to add one more thing with the tracking usage. We also have added an EBS checklist so that when the environmental services people go in, they check and sign, so that we can kind of keep track of how often that room is being cleaned in relationship to how often it's being used. Mm-hmm. And so the EBS piece has been quite challenging to get commitment from that department to go into these rooms and clean them on a regular basis.
Mm-hmm. And I just want to add, in case anyone out there is wondering why we didn't just have a punch lock on the door so that they could get in. We realized early on that we needed to control who was actually going into the rooms, and having a key to sign in and out was the only way we could do it. We could have done it with a badge access. Again, our fear at the time was that we would have folks just decide to take breaks in the room because it was a comfortable room with a comfortable chair, and not necessarily the people it was designed for, which were the moms who needed a pump. And that was why we actually decided to go with a key system to get in and out, which again has had its own challenges. Yes, I think
I would suggest a bigger piece of equipment. We use a big bottle brush. That's uncomfortable to put the key in somebody's pocket and then they forget to return it. That has worked.
Yes, yes. Okay, so next slide. So some of the barriers identified we've talked about. The education, that module that was actually developed by Susie and then changed to meet the network's desire to have the avatar-focused education modules. And then compliance for who was this project applicable to, who needed to have this information, and when. We also got communications involved, and how were we going to push it out, and what level of administration needed to have the education. And that was, I believe, one of the reasons that we were not successful in getting it to be just a mandatory across the board. The question that was asked was, well, you know, this would be something that, you know, everyone in the organization, including our CEO, would have to have. And he does know about this very well. He's heard my spiel many times. And then there was a lack of overall understanding of the program at all levels of leadership. Even, you know, folks who I thought would really be very supportive and understand why we were doing this needed that one-on-one conversation. They needed more than just what they were hearing. I had to actually go and sit with them and explain what impact this would have and why this was important to the organization. Let me see. And I think, yeah, the biggest thing was that everyone thought it was just a women's services project, and you know, I was some kind of a breast person who just, you know, had nothing else to do with my time, I think. The management concerns was about paid time versus unpaid time, and even though it was very clear that this did not need to be paid time, I think there was some human resources issues with how this was going to be perceived, and then what effect it would have on productivity. You know, people had visions of folks leaving the unit for, you know, every 5 minutes to go and pump, and that they wouldn't be able to say anything, which obviously has not happened. And then how long they were spending in the pump room and who was going to do their job while they were off pumping. Part of the employee feedback that I received was that there was a level of guilt for leaving the work area and leaving their assignment, and I had to really remind them and put this forward in the presentations that I gave. At the time, JPS was a smoking facility. You could smoke within the JPS grounds. We are now a non-smoking facility, but I did remind them that employees who smoke had no qualms about leaving the work area multiple times in their shift. And so I feel that when I made that kind of analogy, I think that they got the message. Plus, they were hearing it directly from me that this was okay to do, and we didn't have folks who were challenged by their leadership after that. Next slide. So the teamwork obviously is a must. I mean, there was a lot of work to be done, but there was a village here doing it, I can guarantee you. The multidisciplinary team are groups of folks who worked on various aspects, not least of which was the plant operations department. Every time we seemed to find a place, there was an aspect of it that needed renovating or installation of a sink, or the flooring had to be done. Remember, the rooms that we got given were usually not the prime places in the organization. They were rooms that had to be converted from their current use to the use that we were now wanting to have it for. And so our plant operations were integral in making sure that the rooms were nice and well converted. So and they gave us a choice of paint and the fixtures, etc. It was very, very well done. But as I said, it took a village to do. So next slide. So what advice would we give from our lessons learned? Really, the biggest thing is, well, actually all of these are important, but remember to budget for the ongoing supplies and equipment. We were fortunate to have the grant, which was enabled us to kick this off, and the fact that we added additional rooms in wherever we were allowed to get them, wherever we could get them from, meant that we could not allow the department that owned that space had not budgeted for the supplies and the equipment and the renovation. And so that was very challenging, because what we've had to do is, for all of the rooms we've added, basically Susie's budget has had to take the hit and foot the bill for the additional chairs, etc. The thing we have not had to do is purchase pumps. Our vendor was able to supply us with all the pumps we needed after the initial 3 pumps. Which was a great benefit to the program as well. So don't give up. Really, you just a dogged persistence. Somehow, as I said, if we can make this not a single person's initiative, but actually an organizational drive, and human resources is the best driver of that bus, because there are so many benefits to human resources if they actually get buy-in and get on board with that. Have the team players vested from the beginning, and also very, very important was establish a tracking and education system at the beginning of the journey. Almost more important than any other aspect is making sure that you can track usage, because that's what sells the program when you have to budget for these things later on, is that we obviously have a need that we outgrow very quickly. So next slide. So our last slide, great problems to have. As you can see, we have an employee who is very proud of herself that she created her own space. We heard about a place that was being used at one of our sites at a community clinic, and thankfully somebody came to me and said, you know, there's an employee that's pumping, and her setup doesn't look quite right, and so I told her I was going to contact you. So thank goodness Susie has now visited with her and actually took this picture. It's a great problem to have. The staff know that they are supported to pump, but they're also being very creative about where they can do it based on available space. Our goal is to actually get in there and make their spaces permanent, and then to make sure that they have what they need in the room, the sink and the furnishings, the refrigerator, etc. All of those things that we really want to make sure are in every single room, so that they're at least standardized. Just for an example, we have 8 employees currently in our emergency room, including 2 of those are physicians. And we're working with our design and construction department to identify an area in that area that they can actually use. In the meantime, they've taken squatters' rights over an exam room in the emergency room, which is very, intuitive for them. However, we're not capturing those statistics, unfortunately, of how often our designated rooms are being used. But they are sharing this information with our CEO at his forums, and so it is getting pushed up in the priority list of where can we find a space, and then the dollars needing to be assigned to actually make that happen. So when I started this journey, my goal was for a room in each building, and that was very lofty, I can tell you. Now, obviously, my goal is to have a dedicated room on every floor. And at this rate, it looks like we actually may get there. Because I'll give you an example. In our pavilion, we have 5 floors, and we have 1 room that was designated when we first got the grant, and that room is now we need at least 3 more rooms in that building to service the employees. They're all lining up for 1 room, and it's just not meeting their needs at all. So I'm going to hand this back over now, and hopefully we'll get to address some questions after Maria has given her presentation. Thank you.
Thank you so much, Pat, for sharing that, and Susie as well. It's really wonderful to hear all of the work that you all have been doing and continue to do there at JPS Hospital. At this point, we're going to see if Maria is ready.
Yes, I am.
Perfect. And so we have Maria from LBJ Hospital, who is going to share with us a little bit about the work that they have done to make their worksite a Texas Mother-Friendly Worksite.
Hi, I'm Maria D'Souza, Director of Nursing at the Women Infant Services at Lyndon B. Johnson Hospital, which is one of the hospitals of the Harris Health System. We started our program in 2012, and it was initiated by the employee wellness group that we have at the Harris Health System. And in addition to our hospital, I'm going to say LBJ Hospital, they had it at about 6 other centers too. They started the lactation room, and they got the policy written. Next slide, please. And when doing that, some of the benefits that they realized, it was an enormous employee satisfier. It was improved employee retention. We also now, what we've also initiated and implemented is at every one of our recruitment fairs at Lyndon B. Johnson Hospital, we have the flyer that says, we support you breastfeeding your baby, and we support you as a mother once you come back from your maternity leave. A number of directors have also said that they've had on-time return after maternity leave, so the mom comes back, the employee comes back knowing that she can still support the breastfeeding of her baby and can continue doing that. The location of our lactation room is right near the lactation counselor's office in the hospital, and so they have lactation support whenever needed, and it has also increased staff morale. One of the biggest hurdles that I've seen at other facilities, and I've heard from other facilities initiating that, is administrative support. Fortunately, here at Lyndon B. Johnson Hospital, our executive administrative team has been a lot of help, and their support has been great. That, I think, is more than half the battle won. So when we actually opened a clinic, a freestanding LBJ clinic at the side of the hospital, we were able to get our designation of mother-friendly worksite there, just with the support of a space availability and the furniture and the pumps that needed to go in there. Next slide, please. Next slide. Okay, we also have a breastfeeding policy that covers all the questions that management had, and directors of different departments had, employees had, and what employees needed and what management had concerns about. And it's communicated to every employee on orientation and then at frequent department meetings. So when the directors meet, if I'm at the meeting or an employee wellness program person is at the meeting, they will hand out the flyers to them to make sure that the employees are aware, the new employees coming on board, who if they've forgotten what happened at general orientation, they are now aware that this program still exists. They still can go pump. Their hours are flexible, and they have to get a They get a flexible work schedule from their management that's discussed in prior. The policy also discussed that management can add 15 minutes to their morning and evening breaks or extend their lunch breaks, and they have a policy where someone is able to cover them in that during that period. The room is located away from the general area and is quiet and comfortable. There's a sink, refrigerator with appropriate storage place, and what we've also implemented, we have prenatal breastfeeding classes for moms. That's our patients that come in from the clinics. We also now have prenatal breastfeeding classes for employees to avail of during their pregnancies. So if they come for a certain number of classes, there are incentives offered by the employee wellness programs as well as the employee rewards program. So there's incentives for them to come for these prenatal classes. There's incentives for them to learn about breastfeeding, especially if it's their first baby, and the benefits of breastfeeding and why it's important for them to breastfeed their baby. So these classes were originally tailored just for patients, but now employees can, even if they have to come from other facilities to LBJ, they can. It's at the same time, and the flyers go out to them in orientation as well as during recruitment fairs. They know that this program exists. Next slide, please. That's the pregnancy classes that we have. It's actually tailored from the Becoming a Mom course, where they say they offer 8 lessons to all pregnant employees that are under 32 completed weeks. You can finish the program in 3 visits, or you can come for 8 visits. Each class is 1 visit. Upon completion of the class, you will receive 1,000 reward points, or there are other incentives, and then it's the location to where they come. If you look at the pregnancy classes, they offer you and pregnancy, prenatal care, healthy eating, stress relationship, things to avoid, labor and birth, and caring for baby and breastfeeding, and caring for you. Right now, I think there's part of breastfeeding at every one of those 8 classes. Some part of it mentions breastfeeding and what to do when they are away from the baby or when they can start, and questions that can be answered. We are about to offer these to their significant others also if they want to come for the classes with them. The lactation room, we don't necessarily have a binding contract with them. We have in that one room that we have on the 2nd floor, it's right near the nurseries, there are 3 pumps, 3 stations divided with screens and with curtains as well. So 3 people can use that room at the same time. It's a pretty large room. Also, if that's using, there's a room across the hall that they can use, and then there's one in the clinic that's just come up. And that's directions that tells them where their lactation room, and this is posted on every unit where in their break room, so where employees are aware that there's a room that they can pump or use when needed. Next slide, please. And that's just pictures of our pump room and the flyer that hangs right on the entrance of our HR Human Resources that says, that's a Mother Worksite poster that says that we support you when you are breastfeeding your baby as an employee of the facility. And that's it. I'll give you over to Alma.
Great. Thank you so much, Maria. And at this point, we'll go ahead and take questions. So if you do have questions for Pat and Susie or Maria, please go ahead and type those into the questions panel there on the right-hand side of your screen, and we will take those questions as they come in. So far, we have a question from Allison asking, how long does it generally take from the time you submit your application to the time you receive the designation? And I'm going to actually let Julie Stagg answer that question.
And that's a common question, and we have the short answer is it should take about 6 weeks from the time that we receive it to receive feedback either of approval or need for technical assistance. Currently it takes less than that usually, but that's the amount of time that we're allowed to respond. We have had an increase in the program by about 1,000% over a 2-year period. And so there is a backlog on applications. And actually, in order to increase our capacity to respond to that increase of the program and to further expand the program, we've contracted with UT School of Public Health to provide additional assistance. And so we're working our way through those previous applications. And everybody who's already submitted should be hearing from us soon.
Great, thank you, Julie. And we have another question from Eileen. Will the slides to these 2 presentations be available? And the answer to that is yes. The slides, as well as a recording link, will be posted on the msdcenter.org website by the end of this week. So do go ahead and check that website for both a copy of the slides as well as a recording of this webinar. Additionally, I think there were a couple of kind of questions that we wanted to just share, thoughts that we wanted to share with you based on what we heard during the webinar. So I think Julie had a comment or question that she wanted to share as well.
Yes, and Pat, thank you for talking about how you've engaged HR in your facility. And I was wondering if you could talk a little bit more about the nuts and bolts of that process. Frequently, when hospitals apply, it's considered a maternity services initiative, and like in other employment settings, it's really probably best administered facility-wide when it comes out of HR or another part of the organization that has responsibility for the entire organization. So can you talk a little bit more about how you addressed those challenges in your facility?
Sure. Can you hear me? Can you hear me?
Yes.
Okay, good. I wish I could tell you there was a simple answer, but during the time that we were working on this, we actually turned over HR directors that I was working with at least twice, plus we had at least 2 VPs of HR. And so I would make some headway with how I wanted to roll this out and why this was really important to employees. And then, unfortunately, my contact that was really supportive would leave, and then I would have to start again. Thankfully, the team we have now are here and permanent, and so we're able to support that. But it really was meeting one-on-one and explaining how this benefits employees at JPS. The bottom line is, what is it going to do for JPS? I gave them the statistics about, the money, the dollars that are saved by having employees whose children don't get as sick as often, that the employees come back to work and remain loyal to the facility because they feel that they're supported. I gave them all of these statistics, and that really is the bottom line is, well, how does it benefit JPS? And thankfully, I think one of the aspects that also was really appealing was the fact that we could use it as a recruitment tool. We are the county facility for Tarrant County, and there were times probably 10, 15 years ago when I think the job market was not as good, and we had vacancies. We don't have those situations anymore, and but we are really and I believe they really embraced the fact that we could use it for marketing and as a benefit, not just it's nice to have, but actually an employee benefit, and to support that the female population and the age group as well. So I think that was the deciding factor, was the fact that it could be used in so many different ways to promote what JPS believes. And that happened when we had our new leadership, new CEO, and we had great support from all of those levels. But the stability in the department is something that throws you off. Just being able to maintain that contact with someone who's actually going to still be here to make it happen.
Right. So having a champion,
yes,
in another part of the facility like yourself is probably really important, just to maintain that continuity. So,
yes.
and you've been an incredible advocate in your facility. so many things. So thank you so much for your work in this area. We have another question.
Great. So we have a question from Mary. How do you apply for certification? Is there an online application? So yes, Mary, the answer to that is there is an online application. You can go to the texasmotherfriendly.org website. And on that website, there is a whole host of resources that can help you in the application process, as well as an option to actually directly apply online. If you do have a policy developed or you're working on developing a policy and you want some technical assistance or feedback on that before you submit it for the designation, you can go ahead and email our team, and you can see on the current slide, there's actually our email address right there. It's motherfriendlyworksite@uth.tmc.edu. So our whole team here is dedicated to technical assistance and support for the Texas Mother-Friendly Worksite program. So if you do have any questions along the way as you're going through this process, feel free to email us. We would be happy to answer any of your questions or provide feedback on your policies in advance of submission, or if you decide that you're in a good place and you do want to submit, you can go ahead and do that as well. I'll leave it to Julie and see if she has anything else she wants to add to that.
Nope, I think you've covered it.
All right, great. Another question here from Mary is, if something is missing for certification, will you notify us so that we can correct and reapply? Absolutely. Yes, that's definitely one of the first things that we do when we receive an application is we review it and let the folks know who have submitted that application that there is something that they might still need to add to their application, and then they can resubmit their policy if there were updates. Those are great questions. Thank you, Mary. If anyone has any additional questions, they can go ahead and type those into the chat box. Just to go through a few next steps as we're waiting to see if there are any questions that come in. Again, if you need further assistance with your designation process and you want more information, or like I said, if you want technical assistance before you go ahead and submit your policy, you can feel free to contact us, the Texas Mother-Friendly Worksite Program Technical Assistance and Support Program. And that's our email again, the Mother-Friendly Worksite at uth.tmc.edu. You can also call us at 512-482-6169. And again, there's the website, the texasmotherfriendly.org website listed there at the bottom with a whole host of resources for you as you go through your application process or your policy development process. And also that's where you can actually submit your application for designation. So I don't see any more questions that have come through, but again, you can always email us with any additional questions. Just a reminder about visiting the msdcenter.org website for the webinar recording and slides later this week. Additionally, probably early next week, we're going to be posting a blog that will kind of walk through some frequently asked questions for hospitals who are going through this process or who are interested in going through this process. And additionally, we will send out an email to all of those who have attended to receive HR credit for this webinar. So do be on the lookout for that. The last thing is just in closing, there will be a survey, an evaluation survey that appears on your screen as you exit the webinar. So if you will just take 1 to 2 minutes, it's very brief, to fill out that evaluation survey. That will really help us out to let us know what you enjoyed about this and any opportunities for improvement next time. And again, further questions, feel free to reach out. And we just want to thank you so much for joining us today and being a part of this webinar. Take care and have a great rest of your day.